Hello, everyone. Thank you so much for joining us today for the third National Program Integrity Webinar Series. Today, we are going to be talking about CCDF COVID-19 relief funding, and specifically we'll be covering audits, auditing, monitoring, and tracking funds, as well as fraud prevention and detection. A few call logistics. This is an interactive session with discussion. Please feel free to raise your hand or use the chat boxes. Also, for any tech issues, you can contact Heidi Freimiller at the email address here. My name is Anne Renault Avila. I'm the Subject Matter Expert Manager at Nixia, and we are joined by our team here today. And I'm going to turn it over to for introductions and a welcome.
Thank you so much, Anne, and good afternoon, everyone. My name is Toya Bryant. I am the Director of the Division of Oversight and Accountability in Central Office, and I am joined today by Adi Fatur and Linda Winings, who are our leads in Central Office for Program Integrity and Accountability. And again, as Anne stated, we'd like to welcome you on behalf of OCC to the third webinar of the 22 National Program Integrity Webinar Series. These webinars are part of OCC's ongoing work to support states, territories, and tribes to strengthen their program integrity and accountability efforts, and to minimize the risk of waste, fraud, and abuse. As stewards of public funds, agencies have a responsibility to ensure CCDF program accountability, to safeguard funds, to maximize benefits for eligible children and families, and to spend tax dollars. Today, we will be discussing strategies for monitoring and tracking your CCDF funding to include the COVID-19 relief funding. We will explore fraud prevention and detection strategies and requirements and approaches to audits and auditing the use of funds. We are so very excited to welcome the North Carolina Department of Health and Human Services, Division of Child Development and Early Education Subsidy Services to share programs initiated in response to the COVID-19 pandemic, along with their strategies implemented to support program integrity. These webinars are an opportunity for you to hear from your peers and learn about how this work is being implemented on the ground. We would like to thank the states who have participated on the webinars in the past, and encourage you to reach out to us if you have practices or strategies you would like to share. We value this opportunity and really value participation we have had from the field, and we also use your feedback to help us select topics for these webinars and other TA materials. So please, we continue to encourage you to share your ideas about what you would like to see in the future. And with that, I will hand it back to Anne.
Great. Thank you so much, Toya. So first, we're going to hear from Shannon Mazzaracco today. She is on our subject matter expert team, and she is a fiscal subject matter expert who is going to talk about monitoring and tracking CCDF COVID-19 relief funds. Then we will hear from Mike McKenzie, who is also a subject matter expert in program integrity, and he's going to cover fraud prevention and detection strategies. And then Janae Williams, who is our program integrity lead, is going to be discussing audits and auditing. And then, as Toya mentioned, we will have North Carolina presenting at the end here about program integrity efforts in their states related to the COVID-19 relief funding. And then at the end, we do have wrap-up and next steps, including a survey. So we we'll direct you all to that at the end. So with that, we're very excited to start our session, and I'm going to turn it over to Shannon Mazzaracco.
Thank you, Anne. Good afternoon. As Anne mentioned, my name is Shannon, and I'm going to take you through the monitoring and tracking CCDF COVID-19 relief fund section of today's presentation. So Section 98.68A1 states lead agencies are required to describe in their plans effective internal controls that are in place to ensure integrity and accountability while maintaining continuity of services in the CCDF program. These shall include processes to ensure sound fiscal management. Sound fiscal management is more than just proper bookkeeping. It is a critical component of ensuring the sustainability, effectiveness, and efficiency of the CCDF program. It requires consistent accountability of assets, deliberate internal controls, and robust regulation compliance. As demonstrated in the continuous quality improvement graphic, there is an interconnected and iterative process that involves developing and maintaining budgets, establishing and implementing internal controls, monitoring regulatory compliance and program integrity, and repeating the process as needed to make necessary adjustments. Now we'll cover COVID-19 related funding and tracking recommendations. While lead agencies follow their own laws for expending and accounting for funds, there are general practices they are encouraged to follow, such as gathering information on all sources will help lead agencies determine available funding and to properly budget for and track dollars spent on COVID-19 relief activities. Setting goals and objectives will assist lead agencies target funding to the most critical needs and create a framework for measuring progress towards goals for COVID-19 relief activities. Prioritizing and ranking critical needs will help lead agencies target critical and often limited resources to the highest priorities and needs. Monitoring budgeted funds to actual spending will help ensure that the CCDF COVID-19 relief funds are spent on intended purposes and will highlight any instances in which funds are not being spent as planned. Separately, tracking each CCDF COVID-19 relief funding stream with accounting codes for specific uses is an important step to track CCDF COVID-19 relief funds and can help differentiate these expenditures from existing CCDF expenditures, as well as support reporting requirements. Here we are going to share a few strategies to support COVID-19 funding and tracking recommendations. Creating a centralized authority that approves COVID-19 related relief activities. This could be within the lead agency or delegated to another entity, in which a written agreement may be necessary. We'll cover written agreements in just a few minutes. Some lead agencies with waiting lists have created a central authority that certifies and prioritizes services for essential workers. Others have centralized approval for their grant programs so they can track how grant funds are being spent. And some lead agencies have a central authority to implement and oversee the waiving of copays. Accounting systems with different codes or ledgers to differentiate between each of the CCDF COVID-19 relief funds and activities from existing funding. And finally, setting up attendance and provider payment systems with new codes for each of the CCDF COVID-19 relief funds used for payment. Now let's discuss the monitoring aspect of the CCDF COVID-19 relief funds tracking, which includes the following activities: remote and on-site evaluation of eligibility and payment processes, reviews of financial management and accountability controls, and oversight of information management, quality improvement, and other related CCDF activities and services. Lastly, some lead agencies may use other agencies or organizations to perform administrative and operational duties. In such cases, the is still ultimately responsible for compliance and should ensure agreements outline the roles and responsibilities of both the lead agency and the other agency or organization. According to Section 98.11, written agreements should include at a minimum tasks to be performed, a schedule for completing said tasks, a budget which itemizes categorical expenditures consistent with CCDF requirements outlined in 98.65H, and indicators and measures to assess performance. The purpose of this section was to provide fiscal practices for managing multiple funding streams to assure accountability of the funds and maintaining integrity of the program. And just a friendly reminder to reach out to your regional office to request TA as needed. Now let's open up the floor and talk about some of the strategies that you have implemented. We would like to wrap up this section with an opportunity for you to share with your peers in the chat boxes at the bottom of your screens. If you can share on these two questions. The first one is describe how your agency implemented a monitoring process that collaborates with other agencies or organizations. And the second one is how does your agency track each of your CCDF COVID-19 relief funding streams? We'll give everybody just a few minutes. And I just want to remind everyone on the surveys that we get, we always get higher marks on these sections of our webinars, as your peers really appreciate the sharing because it helps them think about ways that they can do things differently. So please feel free to share. So we have Donna Bauman, says she's new, so she doesn't have an idea what's in place. Oh, but thank you so much for at least introducing yourself, and welcome to the CCDF community. Let us know if there's anything we can do for you. Then we have James Price, a random selection of CCP to verify eligibility and spending verification. The Child Care Provider Portal tracks the payments for each provider. And then we have Tara Valentin. I am also new to child care policy here in Oregon. I am not aware of what our process is. Well, thank you. I hope today's tips that your peers share are helpful. And again, anybody who's new or not new, if you need any TA, please reach out to your regional office. And Nicole Kennedy on the tracking of each of the funds. We have a fiscal unit that tracks the COVID-19 funding streams. And Pamela Prasher, we have monthly meetings with our finance grants team, go over all the funding streams on an Excel document. Okay, very good. And then on the monitoring process, we have Rebecca Banner. We have different monitoring strategies depending on the activity funded. We monitor contracts according to the risk level. We audit payments made through stabilization grants to providers to ensure funds were spent on allowable. Very good. I love how you implemented monitoring contracts according to our risk level. That's a good practice. And then we have Tanika Garrett, I hope I said your name appropriately, on the tracking of funds. Our agency and government tracks funds at various levels. At the accounting level, it is tracked in a financial software with designated codes. At the agency level, it is tracked through a centralized online system for the agency. And at the program level, it is tracked through their grants management system, spreadsheets, and weekly meetings. Very well-rounded. Thank you so much for sharing. And welcome to you as well, Pamela, for being new to your position. Then we have Katie Edwards on the monitoring asset question, and it says she's also new to CCDF family, and she works at the in Oregon as an operation and policy analyst. Welcome. Love seeing a bunch of new faces, names, I should say. We're lucky to have you. Okay, if we have no more, I think we can proceed. So thank you for your time and thank you for sharing. As I said, when you share, your peers greatly appreciate it. One more comment I like to read before we move on. So Dusty Whitaker, we pull a 100% attendance report randomly and review, compare the provider's billing they turn in, and that's in regards to the monitoring. So again, thank you so much for taking the time to share. It's greatly appreciated. We love hearing what all of you are doing in the field. Up next is my colleague, Mike McKenzie. Thank you again.
Thank you, Shannon. Folks, I'm going to take about the next 10 minutes and discuss how internal controls can help to prevent and detect fraud in your child care program and to protect those child care relief funds from fraud. Program administration and operational changes may increase the potential risk areas within a lead agency program. So again, anytime we make changes, you want to evaluate and make sure you have program integrity controls in place. Specific integrity controls to reduce improper payments and potential fraud, waste, and abuse should be developed prior to distribution of provider subgrants. We plan today to discuss a few fraud prevention activity considerations, including defining and communicating fraud, collaborating with other agencies and departments, internal control, and establishing red flag reports. Part of any effective internal control process involves transparency and communication to leadership, staff, parents, and providers, and even the general public in some cases. By outlining and communicating CCDF relief grant program changes, you may find that the feedback that you receive can help you gain insight on what works best for your agency and your state, territory, or tribe. Here are a few communication strategies to consider also. Discussion holders can help your agency understand current processes, challenges, and needs. As part of your implementation plan, we encourage you to establish criteria to evaluate the impact of policy and process changes. And of course, training on changes in internal controls, including updating your manual materials if you can, are critical to effective management of your program. All right, let's talk about collaboration a little bit. Information received by a lead agency, both internally and externally, can support program integrity efforts and your internal controls. To that end, lead agencies should clearly communicate the information needed to obtain quality results. There are a few examples. You can develop partnerships with other agencies through a memo of understanding to share data related to providers or parents. Examples are PARIS, the New Hire Database, and other data matches. Be sure to review data shared from other programs to ensure the information is sufficient in meeting program objectives and goals. And look for opportunities to share resources for investigations or case reviews with other agencies. Effective internal control activities. Program administration and operational changes may increase the potential risk areas within an agency's program. So specific controls to reduce potential fraud, waste, and abuse should be developed prior to distribution of provider subgrants. These include system, policy, and process controls. While many of your existing internal controls are still effective for COVID relief funding, consider some of these other strategies to strengthen your program as well. Here's just a few examples of some internal control strategies that we've had experience with from other agencies. So incorporate a separate second-level review process for provider eligibility determination and payments. This second-level review can either validate or invalidate the recorded transactions and provide insight as to whether policies and processes are being followed. Think about developing staff job duties and staffing structure to ensure proper oversight, segregation duties, and checks and balances. And use your information systems, including data mining and automation, to support your program integrity efforts and reduce errors. Let's take a look at a few of the red flag reports that have been developed. So we've created a little cheat sheet here on this slide for you. Reviewing red flag reports consistently can really help an organization to prevent fraud as you gain insight on possible problem areas within your organization. And in some cases, it's a little easier to acquire data analytics when you already have experience with the program. So one agency we are aware of changed their policy and process to payment based on enrollment during the pandemic. And as a result, they developed the following reports to align with their biweekly payment schedule. They developed reports that identified children enrolled with multiple providers that exceed their time authorization. They created a report to identify providers with enrollments greater than their licensing capacity by age group. They also have a report for children with no attendance in any given week, license exempt providers with non-relative enrollment, and multi-site providers with duplicate staggering enrollment. We've listed a few other reports here for your consideration, but the point is to develop reports or alerts that work for your lead agency based on your demographics, and continually evaluating that and updating those reports to meet your needs. Not quite sure about what would work for you? Remember that TA, or technical assistance, is always available by request through your regional office. So let's take a couple minutes again and talk about this. We'd love to hear from you. We've posed a couple of questions to you and invite you to provide answers in the chat pod. If you have a question, put it in there as well, and we will try and answer it today. If today, we will follow up, make sure we get that answer to you later on. So the information we want to know right now is, what's your favorite COVID-19 Relief Fund red flag report or alert? Did you create any red flag reports or alerts specific to helping you maintain program integrity during the pandemic? And if so, we'd love to hear about that. And then outside of that, maybe it's COVID related, maybe it's not, but what is your go-to fraud prevention and detection strategy? Is it something on the front end? Is it an investigation strategy? We'd love to hear about it, and I'm sure your peers would as well. So we'll give you the next couple of minutes and see if anybody wants to share anything with us. Thank you. Got folks typing, so give me just a minute here. Jason makes a good point here. He says, technology solutions are wonderful, but people and institutional memory are hugely impactful to strategy implementation. And you're absolutely right, Jason. Thank you for that comment. Analysis and that feedback and evaluation that really help to determine whether or not these reports are effective for you. Going to give folks just a couple more minutes to see if anybody else has anything to add. Your peers would love to hear what successful strategies you are implementing out there. And of course, you saw some of the red flag reports are the old standbys, like attendance exceeds license capacity, checking care received after hours. That's always a good one. Driving distance. All right, we're going to give it one more minute, folks. We've heard a lot of really good strategies over the last couple of years, and we've shared quite a few of those with you today. But if you have any others you'd like to share, we'd love to hear about it. Nolan from Minnesota shared with us that for Minnesota Child Care Stabilization Financial Hardship Grants, if a program's reported income is less than the amount of previous grants we've already awarded, we flag that application for technical assistance as a post-application period process. Excellent. Excellent strategy, Nolan. Thank you for sharing that with your peers. We appreciate it. And I don't want to keep you any longer because I want to make sure we leave enough time for North Carolina today. So with that, I'm going to turn it over to Janae Williams to take you through the audits and auditing section of today's presentation. Janae?
Thanks, Mike. As Mike stated, my name is Janae Williams, and in this section, we will discuss audit and auditing. Specifically, we'll discuss subtopics of audit preparation, documentation, and internal support systems. But before we get started, just to keep you guys engaged a little bit here, in the chat box, I'd like for you all to type what you think or know the purpose of an audit is. So what's the purpose of an audit? And let's see what we can gather and see what's already known amongst you guys today. And we have a few individuals typing in the chat box. And let's see what we come up with. Maybe it's something to do with accountability. There we go. To ensure compliance, ensure accountability of funds, validate compliance with contractual obligations, to gather information, checking for compliance to local, state, and federal policies. Great. So you guys already have the underlying foundation of the audit. So let's talk about that a little bit. So in general, audits are conducted to ensure oversight, accountability, transparency, and to improve or to assist in the improvement of government programs and operations. So since there isn't a real crystal ball per se to assist agencies in audit preparation, we wanted to provide lead agencies today with some audit preparation tips for considerations, because it sounds like you all have the fundamental understanding of the purpose of audits. So let's talk about some of those preparation tips. So throughout this section of the webinar, we'll discuss audit resources, the Auditor and Oddity Framework. So we'll understand the process at a high level and how to train staff, audit documentation, ensuring that the documentation for your audit is accurate and relevant, and also discuss some audit internal support systems, right? How can you incorporate processes to support internal and external audits? Now, let's begin with what we call the go-to resources, right? So the resources on your screen can assist you in preparing for audits and conducting audits. The yellow book used by auditors of government entities, entities that receive government awards, and other audit organizations performing Yellow Book audits. It outlines the requirement for audit reports, professional qualifications for auditors, and audit organization quality control. Auditors of federal, state, and local government programs use these standards to perform their audits and produce their reports. Now, next on your screen is the Compliance Supplement, which is a document that identifies existing and important compliance requirements that the federal government expects to be considered as part of an audit as required by the 1996 amendments to the Single Audit Act. Now, without the supplement, auditors would need to research many laws and regulations for each program under the audit, which compliance requirements are important to the federal government and could have both a direct or material effect or adverse effect on a program. So becoming familiar with both of these resources can provide an agency with a solid audit preparation foundation to build on, right? To get those strategies together to prepare for audits. Now let's talk about that framework, right? The auditor versus the Oddity Framework, and beginning with the auditor. So here, auditors, you'll see that auditors are tasked with reviewing administrative records to determine program and fiscal compliance, right? In addition to reviewing the effectiveness of an organization's internal control. Now, this picture provides a high-level framework of the auditor planning and conducting components in which an agency could really build off of for their own internal audit preparation process or to train staff in order to prepare for an audit. So here we'll see that the auditor will request financial and program documents. They will also prepare an audit plan. They will schedule an open meeting, to conduct on-site visits, and then following, they will have a detailed audit. They will detail out the audit findings and also provide recommendations, and they'll draft a report and then submit that final report. So when preparing for audits, you should remember two things, right? Regardless of what side of the audit you're on, the audit should provide objective measurements or provide objective methods, for measuring the effectiveness of internal controls and ensure that upper level management and leadership are aware of the findings, recommendations, and resolutions. So next, we have the auditee, right? So while one caveat or one thing that we'd like to say here, while providers receiving stabilization grants are considered beneficiaries and they are not subject to Single Audit Act requirements, lead agencies and intermediaries implementing stabilization grants are subject to Single Audit Act requirements and the overarching purpose of the actual audits. So audits here, when you're the auditee, audits also ensure that the program activities, procurement, receipts, and payments all comply with the terms and conditions of local, state, federal, territorial, and even tribal statutes and regulations of you indicated at the onset of the presentation. But the auditee, the person who's participating or the organization participating in the audit, is also responsible for ensuring that program compliance and procurement transactions are structurally appropriate, right? So we want to make sure that those internal controls that are implemented are effective. Now, the framework on the screen outlines the activities of an auditee or activities a lead agency can do to prepare or understand and participate in an audit of their program. So you can test the controls, conduct risk assessments, prepare schedule of expenditures, prepare other appropriate financial statements, gather supporting documentation, and be readily available and ready to respond and mitigate to audit Now, thinking about documentation, let's talk about how communication or documentation plays an important part in preparing for your audit. So one thing that we should think about is the audit documentation criteria. So when it comes to documentation, you want to ensure that it is relevant and accurate. And at the start, if you remember at the start of the release of CCDF COVID-19 relief funding, and especially during ARPA, one thing that you may have experienced, or one of the things that we got a lot of questions about, what documentation to include, what should we ask for, what will auditors want to see, and how do I ensure program integrity, right? So one of the first things that I want to kind of bring you guys back to is I want to refer back to those resources that I mentioned earlier, which is the compliance supplement and the yellow. And there are also the links in the chat box. I see that they posted. These can help you understand your documentation needs. Now, after reviewing these resources, an agency can then begin to have those conversations and be intentional in their thinking of what documents are important and should be retained to ensure compliance. Now, on your screen, we've listed a few document criteria considerations, and this is not an all-inclusive list, but it's just something to get you thinking, right? So when you're looking at that documentation, does it support the use of funds? Does it show the agency's process and policies and how they're aligned with the CCDF COVID-19 relief funding requirements? And does it describe the effectiveness or show the effectiveness of the internal controls in place that ensure compliance with the COVID-19 relief funding? Your agency has outlined their document criteria. The next step is to prepare documents, right, and to gather those documents. So there are three things that we have on our screen here, right? Identify, create, and ensure. Now, we all know that things move pretty fast with CCDF COVID-19 relief funds, and there were times when an agency had little to no time to really discuss and plan the methods to ensure accountability or, having the necessary documents. And when there was little understood or provided about documentation, one important strategy to have is a document collection strategy or a document preparation strategy already in place. A practical strategy for documentation preparation can be obtained from understanding the CCDF requirements and comparing those to compliance supplement, and then looking at the regulations and laws that are required in the Act for the COVID relief funding. Now, while this list of information on your screen is not all-inclusive, we did want to pull out the importance of communication, the communication aspect of documentation preparation as a strategy. So with the identification or identify, you have identify, outline, and communicate any applicable financial and program records to be retained by the lead agency, child care providers, contractors, vendors, or intermediaries. Then create. Shannon spoke about written agreements earlier. So creating and ensuring those written agreements outline the appropriate terms and conditions concerning the CCDF COVID-19 relief funds. And now let's talk about, here on your screen are some examples of the documentation criteria. So examples of the documentation includes financial records documenting COVID-19 relief funds expenditures, signed written agreements. You also have the completed CCDF or COVID-19 relief funding related applications, the federal and state regulations, and your process or procedure manuals and desk guides. And lastly, so that we can turn it over to North Carolina and they can talk about some of the great strategies that they've implemented. That is a great question, and we will talk about that shortly here, Mr. Philip Smith. That was a great question. But lastly, let's talk about the audit internal support strategies, right? So for whenever you implement a new program or just want to refine the integrity of and accountability of a program, consider these three support strategies: integrate, acquire, and merge, right? So you can integrate systems and processes for the lead agency to capture information regarding funding requirements. You can also acquire documentation from all individuals and organizations on how funds were used or will be used. And then merging systems, right? So you merge new COVID-19 relief activities into current oversight processes. And this will also assist you in ensuring integrity and accountability of those funds. Now, one thing that we did not discuss in this particular webinar was the mitigating of audit findings. And if this is something that you may need assistance with, we are definitely here to assist. You would just reach out to your regional office to request TA once you have any recommendations. And now let's talk about it for a brief second here, or a few minutes. So in the Let's Talk About It section, we have two questions here. How does your agency prepare for audits, and what documentation criteria is used by your agency? So do you guys have, and I know this is like, how do we prepare for an audit? So most of the times we're given, within state government, we are kind of notified, or when I was in state government, we were notified when auditors were going to come in, our legislator auditors would come in, and we had our outline, our practice, or things that we would do in order to prepare for those audits. So we are asking you guys to share with each other, how do you prepare for the audit? Being that there are going to be some changes in your programs, I'm sure there are other lead agencies or your peers that are interested in how you guys prepare. And then there's the document criteria. Now, in most cases or some cases, there may not be like a formal written process, but program integrity folks and accountability folks and auditors that we have, internal auditors that may be on the line today, when we sit and we decide on what documentation is going to be needed, what are some of the things that you think about in order to pass down the information on the documentation that may be needed for the audit? So it'd be great for you guys to share that information with each other, and then that can also help with Philip's question where he asked, how do you validate written agreements? And I'll give you folks a few moments here. Because when it comes to validating those written agreements, we're thinking about that documentation criteria, right? What are we looking for? What would support that particular written agreement being valid? We have a few folks typing. We'll give it a few minutes. I know we're all eager to hear what others are doing. Give it a few more minutes here. All right, so Amber Mavis indicated in the state of Alaska, so notified documentation are requested throughout the audit. There are a number of people who have roles and responsibilities throughout the process, and we receive questions and provide answers based on regulations, policies, and procedures. That sounds about normal, yep, and very familiar. And it depends on the audit engagement. So let's just say for purposes of this webinar, we're talking about your single audit. Jason? And it could be a performance or fiscal. You can choose either. We have a couple of more folks typing here. Let me give it a few minutes. So anyone has any information that they can share on documentation criteria? Okay, Nicole, can it coordinate with staff to gather possible documentation and also try to review the compliance supplement? Great job. To see what exactly can be audited. We have several programs that are audited at once, so working with each group to ensure documents are sent to me on time. I then submit and upload docs to the auditor. Then I track what has been sent and what is still required, and I ensure all staff will be available during the audit as well. Great preparation and way to stay on top of it. That's one of the ways that you can ensure the success of an audit, right? Is having all of the information available, knowing having a fundamental understanding of the purpose of the audit, and ensuring staff is available, right? All right, we'll give it a few more moments. I see that we have Nolan typing over here on documentation criteria, and I'm super excited and can't wait to see what Nolan has for us. Then we'll turn it over to our state presenter. All right, Nolan says in Minnesota, child care stabilization-based grants were required at least 70% funds to be used to increase compensation of staff regularly caring for children. So we asked for payroll when auditing for that requirement. Interesting. Wisconsin, attendance records, payroll, receipts, and invoices. All right, we'll give you folks a few more minutes to type in, a couple more minutes here, and then we're going to turn it over to our state presenter. And I see we have one more person. All right, thank you all for your participation and your sharing. Without further ado, I'd like to transfer it over now to our state presenter from North Carolina. All right, so we have Ms. Elizabeth Everett, the Assistant Director of North Carolina Department of Health and Human Services, Division of Child Development and Early Education, with the support from Andrea Facer, Administrative Officer 3 within the Subsidy Policy Unit, and also North Carolina FAST Liaison. Thank you both. Elizabeth, the floor is yours.
Hello, good afternoon, everyone. Are you able to hear me okay?
Yes, ma'am.
All right, great. So my name's Elizabeth Everett, and as was said just a second ago, I am with the Division of Child Development and Early Education, and I have oversight for our Subsidy Services section, which is where we administer our subsidized child care assistance program, or what you may hear me refer to as our regular subsidy program. So we were, you can go ahead, or I can advance myself. Let's see, hold just a second. All right. So I wanted to share this afternoon about the emergency programs that we have implemented in North Carolina in response to the COVID-19 pandemic. We have implemented 5 programs thus far. As you can see, we had on the slide, we did have what we called an emergency child care subsidy program, and this program really was targeted for our essential workers who were not already receiving subsidy services. And this program was put in place in April and May of 2020. And we also had a school-age family support program that was later in the fall, in October and November of 2020. And of course, as you can imagine, we really tried to target our school-age population with that program. And kind of running concurrently with those 2 emergency programs, we also had a child care staff bonus program that we were able to institute different times, one in April and May of 2020, so very early in the pandemic, and then the second one was in November and December. I'm going to talk a little bit more about both of those programs, but also just want to go ahead and mention we did have in the summer of 2021 an NC Pre-K summer learning program that was available for families and children who were already receiving NC Pre-K or already enrolled in NC Pre-K, and the summer program was really to target those kids that had lost valuable face-to-face time when schools were remote during the pandemic. And then lastly on the slide, we have our Stabilization Grants, which I'll talk about as well. So when I talk about our emergency child care programs, again, both for the essential workers and for our school-age families, for the essential worker, again, we're very early on in the pandemic, we had our licensed providers complete applications either to remain open if some did not close, and our governor in North Carolina did not force child care facilities to close, but we did ask for our providers to complete applications if they were open or once they did reopen. Within that application, we asked for various information, but very important to these programs that we were trying to implement was we asked for information about the days and hours that they were operating at the time, also about their whether or not they offered second and third shift, and then we kept regular contact with our providers to get information about their capacity and availability if they had available slots to take on additional children. Many of our providers, as I'm sure everyone experienced, were sometimes not operating all of their classrooms at the same time. So it was very helpful to have that information about availability across the state. So at the same time that those applications were being collected, we started working on building an online portal for these emergency programs. In our regular subsidy program, we have an online case management system, and we call it NC-FAST. It stands for North Carolina Families Accessing Services Through Technology. And we have that system already built in place and functional, and so we really built on top of that. We did use a different interface. We actually used Salesforce for our emergency portal, but it was built so that it did interface with our regular case management system, and that system also interfaces with our online regulatory system, which is where all information child care facilities is housed. So having all three of these systems basically be able to talk to each other was very, very helpful. It took a lot of upfront work, as you can imagine. We were also working, double time to try to get this program set up in a very short amount of time. I believe it probably took us maybe 4 to 5 weeks to get things going. So you can imagine we were working furiously with this. And another piece that we built onto what was already existing was how we paid our providers. We pay our providers in subsidy through direct deposit. We have a third-party vendor that we use. It's FIS. And so we worked it out so that we were also able to use the direct deposit process for these emergency programs as well. For families who were interested in taking of the emergency programs, we did have self-attestation applications for our families. In North Carolina, we are a county-administered, state-supervised program. So we have, in all of our counties, we have 100 different counties, and we either, the program is either administered through the local Department of Social Services or through what we call a local purchasing agency if the DSS contracts it out. And so we knew that those agencies were really working hard to work remote and still maintain consistent work with the families they were already serving. And so with that, we decided to actually administer this program from the state level. And so our families, like I said, completed self-attestation application. We asked for them to provide us with their demographic the names and the dates of birth of the children that needed the child care. We also asked them how many were in their household, and on the application, we provided the income limits based on the family size. We did use 300% of the federal poverty level as entry-level income criteria for these programs, so higher level than our regular subsidy. So we were able to serve additional families that we're typically not able to through our regular subsidy. We also had the applicants attest that they were employees of an essential business or of an essential operation, and we used our governor's executive order at the time to really define what the essential business and operations were. So some examples were our emergency workers, our first responders, public safety officers, hospital staff, frontline healthcare providers, also nursing home and group home staff, as well as child care program staff and food service staff. Those were kind of the main categories, but we did allow for an other category where families could write in if they were in an industry that was covered under the executive order, but just not explicitly listed. Also, as part of the self-attestation, we asked about whether or not the families had ever been disqualified from subsidy. We also asked that they attest that they did not have assets less than $1 million. And we asked that they attest to citizenship status as well of the child. And another thing we included on the application was an option for voter registration. If a family was not registered to vote at the time and was in that, there were web links built into the application that they could go and register to vote if they wanted to. And we also allowed, we had probably less than 24 families, but we did allow or have an allowance for families who may need more than what we consider full-time care. So for those families that needed more than 55 hours a week, we did have an allowance for that. Those additional hours so that the pay would be commensurate with the services that were provided. We asked our child care providers to collect and retain those paper applications once the family had completed them and had chosen their child care provider. We did offer resources, of course, to families to, if they needed assistance in choosing a child care provider. Our staff within the division subsidy section were available, but we also really relied heavily on our resource and referral network to assist families as well. And again, that kind of goes back to the first bullet where we were keeping those applications and the status of our providers that were open at the time and what their capacity was, and, you know, any availability that they had. So our R&R network was also involved in that. So we're trying to use as many community resources as we could to help families. The way the portal was built, applications could be uploaded into the portal. Many of our providers did that with no problem, but for those who maybe were not able to upload, didn't have the technology, or just weren't quite tech savvy enough, we did offer them that they could mail in their completed applications. They could mail them to the division office or fax them in, and we helped that way in getting those paper applications uploaded so that we can maintain them for future audits that might come down the road. And then once a provider had been selected and had received their application and uploaded that, what we asked the providers to do within the portal was to record the children's first and last names that they were serving through this program, as well as their date of birth. So we've limited the demographic information that providers had to put into the portal, again, knowing that we had those applications uploaded electronically as well if we needed additional information. And of course, providers did have to record attendance for the month that the program was in place. And the portal was also built so that once attendance had been submitted, it actually calculated payment. There was logic in the background that would run, and it would automatically for the provider based on the attendance that had been entered, so that provider would know what their payment was going to be, and it was broken down by child. So that seemed to be very helpful for providers as well. We use the same portal for our school-age family support program with very similar expectations. The application changed a little bit, of course, with it being a school-age program, but this is basically the structure that we had in place. When we talk about the child care staff bonus programs that we implemented, again, we did one round in April and May of 2020, and then we did a second round in November and December. And again, we asked for, we structured it so that it was not too time-consuming or burdensome to the providers, but we asked them to enter staff into the portal, both first and last name of each of their staff members. We also asked them to record if that person was teaching or non-teaching, because that did factor into what the bonus amount was that employee would receive, as well as if they were full or part-time at that facility. Again, we did ask providers to record attendance. We structured it very similarly, both in for the staff bonuses and for the other two emergency programs. We structured attendance based very similar to our regular subsidy program, in which if a child or a staff member was out for more than 10 days during a service month, then they received prorated payment. If they were not out for more than 10 days, then they received the full payment. And of course, we did communicate out what the bonus amounts were. As for the compensation or the reimbursement that the providers were getting for caring for children, we had those set out in advance, so every provider would know what to expect for each individual child. Again, for the bonus program, we also had that automatic payment calculation built into the portal, and because we were looking at staff members, we did ask providers to retain their payroll documentation, because that would, of course, for audit purposes, be documentation that would be very helpful as to back up the attendance that had been entered. A little bit more about the emergency online portal that was built. We did use a Salesforce platform. We were able to, within DHHS, tap into some contracts that were already existing, and use Salesforce for this portal. So that was very convenient and allowed us to build and stood up in such a short amount of time. We talked about the automatic payment calculation. We also had duplicate name validations built in as well to try to reduce if there were duplicate children, whether a provider may have entered the same child twice. Whatever the case may be, that was a validation that we did build in. The portal also had reporting capability, so we initially built some initial reports of the various data points that providers were entering in about the children as well as the staff members. We can pull all the attendance that has been recorded, as well as all of the payment calculations and payments that have been made. If you're familiar with Salesforce, it's quite a user-friendly platform, and we're able to edit those data elements or whatever it may be as we receive requests for various information. And the portal was also built so that we were able to control access to the rosters and lock the rosters for payment extraction. So this portal was available 24/7 for our providers. And so we did our payment extractions later in the evening, typically after 9 p.m. when we knew that there would be less activity in the portal. And we were basically able to kind of lock down the information that had been entered thus far. Of course, we gave providers deadlines of when they needed to have their attendance entered. And then when we had a scheduled payment extraction, we would lock those rosters, and then that way we would know who to pay for what the services that had been provided. And then if we had a provider that missed the deadline for whatever reason, able to easily catch them up in the next payment extraction that we did. And so that way providers got paid for the services they provided, but excuse me, I'm so sorry. My office mate wants to join in on the conversation. I apologize. But so when we locked those rosters, anyone who had not submitted their attendance, if they submitted it after that deadline, we were still able to pay them. It would just be at a later date. All right, so that's a little bit more about our online portal. And with all the integration that we had, again, it was a lot of work up front, a lot of coordinating and getting all the right people on the same page to get these things in place. But after all of that, we definitely appreciated all of that work and that integration, because it with payments flowing very smoothly, and us being able to really track and keep up with what was going on. One other thing I wanted just to expand on a little bit more was how we paid our providers. Again, we already had a contract in place that we do direct deposit through FIS as our vendor, and so we were able to leverage that contract and those processes, so that when we extracted payments from this new emergency portal, we were then able to basically get our payment files such that we were able to send them over to FIS, so for direct deposit. So that was very convenient. Also, one thing to note about our emergency child care programs, both that we did, we had typically in our regular subsidy program, our licensed child care providers have to have a 4- or 5-star license. With these emergency programs, we did open that up so that those facilities with 1- and 2-star licenses were eligible to participate. And so we had quite an influx of providers who were not already set up in our regular subsidy system, both in the portal and with the direct deposit. And so it kind of became an all hands on deck with the subsidy section and the consultants guiding providers through the enrollment process so that they could have access to the online portal and then get their direct deposit set up so that they could get their payments. So again, we pulled in a lot of the resources that we already had and already used, and just tweak them and able to leverage them for these programs. To talk about stabilization grants, so again, the same child care or the online portal that we used for the emergency programs, we also built the grant application within that portal. So the application is accessible to providers online. And again, they have to have access. We use NCID to allow providers access. And we are requiring quarterly updates and then 6-month recertifications. And so we started in October with our stabilization grants. And so we are, 3 quarters in at this point. As far as monitoring of the stabilization grant payments, the monitoring team is tweaking or has developed and is tweaking and getting our monitoring protocol finalized. We have a monitoring team that monitors all of the division's contracts, and so we have pulled those folks in to monitoring of our stabilization grants. And we are planning to audit or monitor a sample of providers and that have received these grant funds, and then, of course, any that we have concerns about, whether it's been through someone reporting concerns or some things that we may have stumbled across. Of course, those would be included in audit as well. And so right now, the monitoring team is auditing a sample of child care providers that have received stabilization grants. And once they get everything finalized with their protocol and their processes, then, of course, we will move into doing random sampling of providers that will be monitored. For our quarterly updates and our 6-month recertifications, we do ask that give us detailed information about how they have spent their funds thus far, both the fixed cost portion of the grant and the personnel portion of the grant. And again, they have the ability to upload documentation into the portal. So we ask that they do that. And if a provider has not been able to spend all of the funds that they have received thus far, by the time the quarterly update comes up or the 6-month recertification, we ask that they submit a written plan of how they are going to spend their funds in future months. And so more to come on monitoring of stabilization grants, but that's where we are right now. So this is the information I wanted to share today. I think that is my last slide. Yes, it is. So I'm definitely open to take questions that there. And I do see a question from Nolan Fine. Were family child care providers included in North Carolina stabilization grants? Yes, they were. When I refer to licensed child care providers, I am including both centers and family child care homes. So they were also eligible to participate in both of the emergency programs that we did, as well as the staff bonus programs.
All right, looks like we have another question, probably, Elizabeth.
Okay.
Great information. Great information. Thank you so much for that.
Absolutely. Happy to share.
Thank you. Give it a few minutes here.
Were family child care providers able to submit all that information easily, or did they need a lot of tech assistance? That's a great question. Using the Salesforce platform, we have found that is a very user-friendly interface, and we actually received very positive feedback from providers around the ease of using the system. But we also did, to assist providers, we had what we call job aids here in North Carolina, and they are basically documents that provide step-by-step instructions to users, whether it be the Salesforce portal for one of our emergency programs or the stabilization grants, whatever the case may be. Those job aids do provide those step-by-step instructions, including screenshots or action we're asking the providers to do from the very beginning of how to set up, get an NCID so that you can get access to the system, right through, entering children's information, staff information, attendance information, all of that. And so they did have that assistance. We also did enlist the assistance of what we call our NC Fast help desk. That help desk provides technical assistance to our providers if they're having, technical problems. And then we did have staff within the division as well to assist providers. And Arletta Lambert just chimed in on that, so perfect timing. We offered a customer service team to assist providers with any and all parts of the stabilization grant process. So we had many division staff members who were available for phone calls, emails. We did multiple webinars for our providers as well. Let's see, Hope, who is the team that is developing your stabilization monitoring protocol, and would it be possible to contact them with questions? Yes, I think we can definitely set that up. They are actually on the call listening right now, so I will call them by name, Ed Skeens, and let's see, is Ed on? I believe he may not be able to talk, but Ed is leading that work. And we can definitely get you hooked up to talk about questions that you may have more specific to their monitoring protocol. And Patsy Stone is also on the call. She is also with our contract monitoring team, and is working on that as well. So I think we can definitely get you connected there. afterwards. And thank you, Janae. That is my email address. Hope, if you don't mind, shoot me an email so that way I have your contact information and I can get you hooked up with Ed and his team. And anyone else who has questions after, feel free to send me an email. I'm happy to provide, any additional information or answer any additional questions that you may have afterwards.
Thank you so much. Thank you so much, Elizabeth. And yes, Nicole, there is a copy of this presentation. It's available for download here in the Program Integrity Resources pod. You scroll all the way down to the bottom, it's number 8 here. And I'll put in Elizabeth's email address here as well. Those of you who may have, perfect. Thank you. All right. Well, again, thank you so very much, Elizabeth, for that wonderful presentation. It's always very helpful and useful to get a lead agency perspective on things and to actually, for other individuals or your peers to see what that work actually looks like. It's one thing for us to talk about it on a program integrity webinar, but I know it's a whole nother ball to actually have to implement those activities. So we appreciate you and we appreciate Andrea for taking the time to come and speak with us today. Thank you very much.
Absolutely. Thank you.
All right. So we also wanted to provide to you guys some helpful resources that are available to you. You have the CCDF project, the internal controls self-assessment. There's also a link here for the Office of Child Care COVID-19 resources, which there are a lot of great resources listed there. Also in the resources pod for program integrity, there's the Strengthening Stabilization Grant Integrity Brief and Assessment available for download for you folks. All right, and to wrap it up today, there will be an evaluation. I'll leave the room open for a few minutes for you guys to complete an evaluation, which helps us tailor future webinars based on the needs. Technical assistance is always available upon request through your regional office. And our next program integrity webinar is tentatively scheduled for September 20th. 2022 from 3 to 4:30 p.m. I'd like for you guys to tell us what you're interested in hearing about next. What topics do you guys want to hear about next? So definitely complete the webinar evaluation here. It was great having you guys come by. Thanks again and enjoy the rest of your day.